And let's pick up this comparable effectiveness research idea that's also in the stimulus bill. This is the first time I've seen it, and what it is it's sort of it seems like it goes with this value-based. It would somehow be judging treatments, judging practices, and then deciding whether or not the federal government would reimburse for certain types of things. I'm not very familiar with it. Could you explain a little bit of it?
Healthcare may be the one service or product in our country where we pay as much, if not more, for poor quality care as we do for good quality. And the idea here is that before the federal government as a purchaser of healthcare should simply pay for various treatments to determine whether or not, to what extent they in fact are effective. And that is obviously a concept that private purchasers are also trying to begin to integrate within their own plans and operations. So the idea here is there are some existing programs along those lines. Here's to provide some extra funding to move that forward, but there is going to be a much broader debate around that whole concept of trying to understand, is a particular medical device, a particular drug, a particular treatment protocol effective enough to warrant the type of reimbursement that would be required for it.
And real quick, I mean, has your group and your members come out or come down on that issue? I mean, would this be something, let's say it's not a stimulus bill, but it's coming up on its own. Are you for or against it?
We're certainly for, and as part of our 10 prescriptions for reforming the healthcare system, we call for more efforts in this area of comparative effectiveness research as well as in the health IT area. We do think that it has to be done prudently and recognizing the subjectivity of all of this, and to be sensitive to the extent to which healthcare is both an art as well as a science. So there do need to be the appropriate parameters for it, but conceptually we certainly are supportive of it.
Now I want one more segue, and we should have done this at the beginning, but we'll do it now. We're going to segue to a question or two from my colleague Elizabeth Galentine, who's just joined us over at Employee Benefit Advisor. She was up on Capitol Hill yesterday. Do me a favor, though. I mean, you're a long time sort of Capitol Hill person. Tell folks a little bit about your experience, and then real quickly, the group, your membership, sort of how you keep the lights on, things like that.
We are a group that's been around for about 40 years. We represent primarily major employer plan sponsors on the full range of health and retirement issues. Within our membership itself, there are also those who provide services to employers and sponsor plans, both health and retirement plans, and we advocate for them on the full range of employee benefit issues.
And how long have you been here?
I've been here for 20 years.
There you go. Now, Elizabeth, why don't you go ahead and share, as I said, she was up there for our committee hearing, and she heard an interesting comment, and we'd be interested to hear your thoughts on that.
Yeah, just as before the committee meeting even started, I was standing in line waiting to get in, and there was a man there who was serving as a placeholder for a lobbyist who planned to come later and sort of get his place in line. And the man commented on that the line wasn't as long as other health meetings have been in the past, because he knew this one was going to be focused on wellness, and that money's not in wellness, money is in sickness. And I thought that was interesting to, what are your thoughts on that as far as focusing more on sickness and wellness and how that could help with the stimulus in the future?
Well, I think one of the things that's really different about the emerging debate now on healthcare reform from past debates that we've seen and been a part of is the much greater focus on wellness, on ensuring good quality outcomes, on focusing on the issue of cost. Past debates about healthcare have typically been mostly about the issue of coverage. And obviously with more than 40 million people lacking healthcare coverage in this country, that's a very important issue that must be addressed. But equally important is this idea of promoting good health and focusing on chronic disease management and wellness promotion. And to their credit, President Obama and other congressional leaders who have been talking about the need to reform the healthcare system have paid a lot more attention this time around to the issues of quality, wellness, promotion, and those types of things, and I think that's an encouraging sign.
One other question in relation to health IT that you mentioned on a little bit earlier. In the committee yesterday, the doctors that were testifying were mentioning, the benefits of installing these new IT programs. One of them was having a handheld device for doctors to access patients' records right there in front of them. And they were mentioning how that would help with wellness in the future. And you know, obviously there are significant cost benefits of having healthier people on the front end rather than dealing with their sickness later on. Do you think that that's something that needs to be focused on more with Congress, as far as they're talking about stimulating the economy by creating jobs, and will these IT things create jobs? But where's the talk about, you know, where the money will come from not having to pay for the sickness?
Well, and in fact, I think that most of the proponents on Capitol Hill of healthcare reform are hoping to at least pay for some of the cost of reforming the system and the cost of providing subsidies to help low-income individuals have coverage through the savings that should be achieved through some of the reforms themselves. Again, that's a little bit hard to sort of lay one's hands on and know with any degree of certainty how much savings can really be achieved to help pay for it, but theoretically it should in fact happen. And you know, absolutely, I think that it is incredible that our healthcare system, with all the technological capabilities that we have in this country, how much of this system is still paper-based, which not only leads to enormous inefficiencies, but actually contributes to the likelihood of medical errors that injure and kill people. So for all of those reasons, it is absolutely essential that there be this focus on health information technology. It should create jobs, but even if it doesn't, it should create enormous improvements in productivity and quality in the healthcare delivery.
Thank you.
Jim, last question for me is just what's coming up on your plate? Like, what's something that our employer listeners and readers and our benefit broker readers and listeners should be paying attention to that might come out of ABC in the coming months?
Well, I could cite three things. After we get beyond this economic stimulus bill, I do think that the broader healthcare reform debate will start up in earnest. And of course, there are 10,000 different moving pieces to that. For major employers, they're particularly concerned, well, there are many items they're concerned about, but preserving the ERISA federal preemption to allow major employers that operate across states to have a uniform system of rules. On the pension side of the ledger, there is a very urgent need that Congress reform the funding rules for defined benefit pension plans. The combination of the new funding rules that were enacted in 2006 and the dramatic drop in the stock market has resulted in companies having much greater unexpected pension funding obligations to their plans, coming at the worst possible time in terms of companies' ability to make those payments. Beyond that, I do think that the drop in the market has also focused on increased scrutiny over the 401k system. And so a big part of our effort is going to be to help educate our policymakers on the intrinsic value of that defined contribution 401k system before they act precipitously to curtail it simply because of the realities of what has occurred to account balances in the current economy. It is a good system. We should have a strong defined benefit and a strong defined contribution system, and not look for scapegoats as a result of the fall in the stock market.
Great. Thanks so much for your time today.
Thank you.